Quebec's premier is now giving Montreal the green light for opening stores next Monday and daycares on June 1st. The province has the highest infection numbers in the country, with more than half in the city of Montreal. To find out why Montreal has such large numbers, I'm joined now by infectious disease specialist Dr. Matthew Otten. Doctor, thank you so much for being here. Most of Montreal's COVID-19 deaths have been in seniors' residences and long-term care homes. What factors can explain this?
So I think the entire final story has not yet been written on that. But I think it's fair to say that if you look at Quebec compared to other provinces, that we have a higher proportion per capita of people in these long-term care facilities, what we call CHSLDs in Quebec. And unfortunately, SARS-CoV-2 has a predilection towards causing severe disease in people who are older and have multiple health problems. And these CHSLDs are really sort of concentrations of those very vulnerable people.
Doctor, some provinces restricted movement of workers between care homes, while Quebec gave itself the authority during the pandemic to move them around as needed in response to staffing shortages. What should the province be doing here?
It's a hard question. There was a real all-hands-on-deck approach from the provincial government to try to fix this looming and present crisis in the CHSLDs. So they made the decision to move all sorts of workers from hospitals to CHSLDs, and then that was a short-term fix, but at the same time, that also, I believe, posed a risk to those workers who then might be coming back to their original places of work without having been properly quarantined to wait out, make sure that there's no cases of transmission from the to the hospitals where they would be returning to as a result of their work in the CHSLDs.
Doctor, what do you make of the reports that overcrowded neighborhoods could also be a contributing factor?
It really seems as if this virus is quote unquote programmed to take advantage of our society's weakest and most vulnerable. And we see this happening over and over again. It seems to have a predilection towards causing disease in the old, in people who have multiple health problems, and in people who are socioeconomically disadvantaged. And again, that's another thing that I think did not play to Montreal's favor, is that we have some of the poorest neighborhoods of any urban city in Canada. So this really speaks to the importance of proper housing, good ventilation, all these kinds of measures that we know are important determinants of health.
Lastly, and we only have a few seconds left, are there any other factors unique to Montreal that could explain why COVID-19 has become is so difficult to contain on the island of Montreal?
I think Montreal, as being sort of the largest population center in Quebec, also was hit hard by having that early burden of disease from the early spring break that happens in this province. So I think we got a large influx of disease early on, and I wouldn't be surprised if there even was some community transmission earlier than we expected while we were still looking for it in the traveling population, but that's going to remain to be proven.
Doctor, thank you so much. We appreciate your time today.
My distinct pleasure.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.